Okay, this is the part where the heavy lifting comes in, but the guests we have are going to make it exciting and engaging. I'm taking myself out of that equation. I'm depending on you to make this fun. But we have some really vital information we want to get out of you. Let me do some introductions first. Tim McBride, you just met him from Washington University. The guest's so nice, we had him twice. Yvonne Buehlinger with Grace Hill, thank you for being here. And also Bill Hill, insurance broker with Visor Benefits.
Correct.
So before we start our conversation, just about a month ago, as part of our ongoing coverage of health here, Anne-Marie Berger from the 9 Network went out. She caught up with a young woman who is dealing with these very issues that we are trying to explain here tonight.
My name is Marie Enger. I'm 23, and right now my primary source of income comes from cartooning.
Enger is doing what she went to college to do. She illustrates and often writes her own graphic novels. She's a freelancer, and for her, working full-time means working all the time.
Yeah, I work about 90 hours a week. If I'm not sleeping or at someone else's house, I'm drawing. There's no downtime.
And she's not complaining. Cartooning is what she loves to do. This is what she's great at. But for someone who is just starting out and working for herself, affording health care is always a concern.
Oh my gosh, yes. I have a pre-existing condition, so without health care, I can't function. I need my medication. I need to go see doctors.
Marie is affected by mental health issues, and without insurance, her prescriptions would cost about $1,500 a month. Fortunately for her, under the Affordable Care Act, Marie is covered under her parents' insurance until her 26th birthday, bringing the cost of her prescriptions down to a mere $300. Are you aware of options that you have?
I've seen some things on like internet sources about it, but nothing super definite.
While she is covered now, she is very concerned about what will happen when she turns 26. Does having a pre-existing condition concern you that you'll get turned down for health insurance?
All the time, yeah. I've got a big one too, so it's kind of a really scary, ugly word that while in reality, my life is great. I'm really happy. On health insurance, they're gonna see this as a really big risk for them. And they're not gonna wanna give me a good rate or insurance at all.
Anyone between about like $15,000 a year and $46,000 a year in annual income will qualify for some sort of tax credit on the marketplace. So that really helps young adults, especially those with lower incomes or entry-level jobs, things like that, will probably be able to get affordable health care coverage on the marketplace. There are a few things that it does require.
So the young invincibles have their work cut out for them, not just in explaining the benefits of the marketplace, but spreading the word that it even exists.
Preventive services.
Take Marie, for example. Remember, she's a college graduate who's concerned about the cost of health care. Have you heard of the marketplace? Health insurance marketplace?
No.
You'll be happy to know then with the ACA that pre-existing conditions don't matter.
Yes. Very good. Good to me. Good for a lot of people.
So we were able to catch up with Marie before tonight's show. She tells us she has not shopped on the marketplace yet, but the moment she turns 26, no longer on her parents' insurance, she will. Okay, back to the table to really break down what this marketplace is, as we established, also known as the exchange. If you already have insurance, how does it impact you? Because I feel like a lot of people who are interested and have questions about this have insurance themselves. What does the marketplace mean to that person?
Well, it could impact anyone who's currently on a state guaranteed pool. They're going to have the option to go directly to the carriers or to the exchange and get coverage the same as everyone else. So they would not be limited to those high ratings and also to the limited benefits that are offered through the guarantee issue pool.
If I have my insurance through my employer, does Marketplace, can I just put that aside and never think about it again, or does this apply to me too?
Generally, that's the case. I mean, I think for most employer plans, especially if you're in a large employer plan, it's probably not going to be affected other than the usual sort of increases that happen to employer plans. So, but if you're a small employer plan, you know, this might offer up some new options for people. And you know, the Affordable Care Act is going to offer some changes to, you know, for people with pre-existing conditions, as we've already discussed.
do I have to, okay, I don't have insurance now.
Right.
I was just fired. I don't know if anyone told you, but I'm sad. But I now don't have insurance. Do I have to use the marketplace? Is that where I have to go?
No, it's not. You can go outside the exchange and get coverage from any carrier. In fact, you would probably have more options available to you outside the exchange than inside the exchange. In the state of Missouri, we actually...
Wait, say that last part again.
Okay, you'll probably have more options available to you outside the exchange as opposed to inside the exchange. Inside the exchange, in the state of Missouri, we have 2 carriers, 20 plans. So your choices are going to be limited to those 20, either 10 with Anthem or 10 with Coventry. There are a whole host of carriers, United Healthcare probably being the largest, who are outside the exchange and have those same level plans available to everyone.
To meet those qualifications.
However, the advantage of going in the health insurance marketplace is that if you are under 400% of poverty, somewhere between 100 and 400%, you would potentially qualify for the tax credits. And if you are up to 250% of poverty, you also may qualify for the subsidies. That would help you in the event that you have, a large medical expense.
Which I believe those numbers roughly break down to, help me out here. If you're single, what, $45,000 and you might be looking at those subsidies.
Right. If you're under 100% of poverty, if you're a single person, is somewhere between $11,500, something like that, all the way up to $45,000 is the 400% of poverty level. So then you would qualify for a tax credit for your premiums.
Yeah.
And for a family of 3, it's about 23,000 up to about 60,000 or so.
These are the tax breaks, if you will,
Right.
that to help you pay your premiums.
Right.
The monthly premiums, right.
Is there someone who can't use the marketplace? Is there anyone who cannot use the marketplace?
Well, if you have Medicare, you, for example, don't have to go onto the marketplace.
I mean,
And if you're on a qualifying group plan, then you are not eligible for coverage in the exchange.
You started to say?
I mean, those are the groups that are. I mean, if you already have coverage, that's
Okay.
then you don't need to go to the exchange. So.
Okay, so you mentioned, we were just talking about premiums. There are different levels inside the marketplace. What is that about? They even have nice gold and platinum, and what does that mean? Is this, am I getting different coverage depending on what I can pay for?
There's essentially, we call them the metal plans. They're the gold, silver, bronze, and then there's, for the young people, there's catastrophic plans. In Missouri,
Don't forget the platinum.
Yeah, there's,
there's
well, but in Missouri, there's not going to be very many platinum plans. Outside of Missouri, there's going to be platinum plans. So and they have different levels of premiums. And if you get into the marketplace, you'll see different. I think it's very important to use the navigators and go to the website and look at what the co-payments and deductibles and other options are that people can look at, because the premiums is not the only thing that people should be looking at.
Casey, one thing to keep in mind about the metal levels, they're more a measure of an individual's out-of-pocket expense than anything else. So there are different plan designs within each one of those metallic levels.
Meaning the coverage, it may cover the same thing, it just may cost me more out of pocket, either up front or when I get the procedure.
Correct.
I think I've been pleasantly surprised at how cheap the plans came out to be in Missouri. They've ranged for a 27-year-old from about $150 to
Yes.
$600 or so. That seemed relative for a month. That seemed relatively low to me. I haven't been able to look at maybe you have.
Well, Tim,
the co-payments.
if I may
if we can disagree a bit,
if I may
you want.
interject here, I can I can help someone purchase a plan with Anthem or Coventry right now. That same 27-year-old will cost $50. So when you're moving to a
healthy
plan,
person right now, probably.
That's correct. That's correct. But if you're moving to the exchange plan and you are 27 years old, you are going to see a 150% increase.
But that's a
January
person
1.
that's totally healthy right now. This has been the problem with the insurance marketplace, and so I mean,
Totally healthy is a measure. There are people who are accepted who have conditions every day.
I mean, I insured my niece, and I got a very cheap plan for under $100, but it didn't cover pregnancy, and it didn't cover her gallbladder because she had previous gall surgery. So this has been the
You're
problem.
talking about
with
inside or outside the marketplace on that?
This was a few years ago.
Yeah.
This has been the problem of pre-existing conditions for years. And so now we're having a level playing field, so that's totally not going to happen. Now that was the problem with that was covered by the previous film. So yes, the premiums are going to be maybe a bit higher, but everybody's going to be on the same level. And also young people, maybe the premiums are going to be a little higher, but so I think we need to look at this a little more carefully.
But the only reason your niece had a pre-existing condition is because she did not have coverage prior to.
No, it was because she had gallbladder surgery when she was 15 years old. So she had her gallbladder taken out.
Right.
And she was of a childbearing age. She was 22 years old.
And you were told about those. You were told about those when you purchased the policy,
yeah,
right?
and she had a deductible that was $4,000.
So the thing I would recommend, Casey, that I think is most important, even for people who are going into the exchange, they need to speak to a qualified agent, somebody who knows not only what the plans are in the exchange, but also what coverages are available to them from other sources.
Including the navigators we're talking about. Does that help too?
The navigators cannot discuss, or at least they're not supposed to be able to discuss other aspects of insurance. They're supposed to inform, tell people about the plans that are available, tell them what kind of subsidies are available, but they're not supposed to get into the intricate nature of the insurance itself.
I want to bring up something, gateway to better health,
Sure.
because that's something that we want to bring up in this table that we haven't touched on yet. So what can you tell me about that? What is that?
Well, Gateway to Better Health is a special program that is only available in St. Louis. Is for people who are under 100% of poverty, and it's coverage plan only available in certain federally qualified health centers as well as the county health department. So when people apply for the Gateway to Better Health program, if they're adults, again, then they can receive care. They don't have a premium, and their copays are between 50 cents and $3, depending on what it is.
And has this been extended?
It was extended until the end of next year, so another year and a few months.
Okay, but that